Welcome to the Find Your Leadership Confidence podcast with Vicki Nedling. You are about to discover impactful lessons that help you grow as an individual, grow your confidence, and find the positive and good within you, so you powerfully and authentically become the best version of yourself. Be sure you visit our website at www.findyourleadershipconfidence.com. While you're there, subscribe to us via your favorite network. Now tune in, get ready, and enjoy the journey of emerging as a leader of exception in the 21st century.
Welcome, everyone, to the Find Your Leadership Confidence podcast. I'm your host, Vicki Nedling, coming to you from Roswell, Georgia. The goal of this podcast is to bring topics and guests that will empower you to take your business or your life to the next level by becoming that confident leader. I am excited to talk to you about a great subject that we all need and we care about. Harlon Pickett will be my guest today. And let me tell you about Harlon. Leveraging almost 2 decades of rich experience in the healthcare industry and his profound knowledge as an insurance broker, he journeyed through the shifting sands of insurance and healthcare sectors. And over the years, he learned to adapt and innovate, and most importantly, to recognize the need for affordable yet comprehensive insurance coverage that caters to the unique needs of every individual. Inspired by this realization, he championed the concept of alternative funding solutions, disrupting the traditional insurance landscape to make room for more flexible and personalized healthcare plans. They have revolutionary offerings at Eagle Care Health Solutions, and they are crafted with a single purpose: to ensure that everyone gets the healthcare they deserve without having to break the bank. As we broaden our horizons, we seek to empower the brokers with trailblazing, easy for me to say, health solutions. Mm-hmm. And so Eagle Care family brokers can transform lives by facilitating access to optimal healthcare nationwide, while also reaping significant professional benefits themselves. Harlon says that his role is to bring wealth of insurance and healthcare knowledge to the table, aiding brokers in their journey to success and guaranteeing that the clients receive the highest standard of healthcare services in an otherwise convoluted industry. Well, it is my pleasure to have this conversation with Harlon Pickett and we have aptly chose the theme for this wonderful podcast as, why does healthcare suck? Now hold yourselves back, get your pen and pencils, because you're going to want to take some notes. Please join me in welcoming Harlon Pickett.
Wow. Thank you so very much, Vicki. That was awesome. I'll tell you, it sounds all, my whole intro sounds all crazy and convoluted too, right? I mean, it's all so many words in it. What does it mean? I guess it's almost as complex and crazy as the whole healthcare system is anyway, right? It's so funny that you went through that whole thing and I'm listening to it just laughing at myself, because I'm like, wow, I'm trying to make things easier. And my whole intro is just a whole bucket of craziness and big words and everything that half the people don't even understand what's going on there. So that's really funny, but I really do appreciate you having me on the podcast. And I am very excited to share with your audience, why does healthcare suck? It's one of those things where even when you have a good experience, let's just say that you really, really like your doctor, you've had this doctor for a long time, you have a great experience with them, but it seems like you still get bills you don't expect. It seems like if anything else happens outside of that, they refer you to someone else, or you, heaven forbid, you have to have some type of procedure. The whole process is just designed to drive us crazy.
Yeah.
You just don't understand what's going on. It's so complex. And it's really been to the huge detriment of the health not just the healthcare, the health of the United States citizens.
Mm-hmm.
We spend more on healthcare than in any other country, and it's not even close. Not even close. But we have some of the worst outcomes on that, and including the fact that of all of the wealthy nations, as they would say, we have the shortest lifespan and the worst overall health. And it's a complete, I hate to say it this way, but it's completely the way the whole healthcare system is devised. You know, people like to say our healthcare system is broken.
Mm-hmm.
And I'm going to tell you right now, Vicki, it's not broken. It's working exactly the way the individuals that are in control was designed. It is enriching some and bankrupting most others. Still to this day, the number one reason why people file bankruptcy in the United States is medical debt.
Yeah.
And unfortunately, about 80% of those folks had health insurance. So where's the disconnect there, right? Where's the disconnect? Why, if I had health insurance, if I was doing the financially responsible thing and I chose to have a health insurance plan, why am I still not protected? Why am I still having so many huge bills? Well, there's a number of reasons why, but one of the big things that's happened over the last few years is the huge increase in our deductibles. So when someone's got a huge deductible, I don't care really what it is, but let's just use a nice round number of $5,000. If you have a $5,000 deductible and most people in the United States don't even have $400 in their savings account, you're functionally uninsured. It's just like you're paid, but unprotected. You don't have the protection you need. And people are so frustrated with this situation. This is a staggering number. 61% of American citizens do not go to the doctor unless they're sick. Period. They won't go unless they're sick. Well, where's all the preventative care? Where's all the let's take care of myself to make sure I don't have something bad happen? They're afraid to go. They don't know what it cost. You know, to give you a quick analogy, would you go to the local department store and buy a flat screen TV without knowing how much it is?
Yeah, that's right.
Would you do that?
Yeah, no, you would not.
Wouldn't. But people have doctor's visits, people have surgeries, people have all X-rays and other imaging all day long, never knowing how much it's going to cost, and unfortunately, never even asking how much it's going to cost in many cases. And if you do, most of the time, what do they say? I don't know. I can't help you. We won't know until it's done. Huh? What do you mean you won't know till it's done? You've never done this before?
Yeah.
Of course they've done it before. They just simply don't want to give you that information. This is why we have such egregious billing practices by so many of your hospitals. And this is also why there's such a huge spread in the cost of certain surgeries and certain procedures that could be dramatically different from one hospital to another, and then even a big difference in, say, a surgery center versus a hospital. But the whole system is so confusing, and it really keeps people from getting the services that they need.
Yeah.
And that is one of the biggest issues that we have.
Yeah, for sure. So, you know, like for me, I only have one prescription and I'm 65. And so I'm paying all this money to Medicare and United Healthcare and WellCare. And you know, for what?
Yeah. And then the other side of it is now that you're on Medicare, I'm sure that they told you if you elect not to go ahead and take it right now, then there's going to be a penalty when you decide to take it later.
Yeah. Yeah.
Well,
which,
hold on a
of
second.
course,
Well, why am I paying for it now if I don't need it? That's
yeah.
but you're
Yeah.
still in a better situation than most people in corporate America are.
Oh yeah, for sure.
With high deductibles. And then also, even if they can afford or their employer pays a big chunk of what their insurance cost, then their families typically are unable to get coverage because of how much it is. It's a ridiculous amount of money. The amount it costs for health care for a family of four, and that's insurance and all kind of services they may need. The amount that for 2023 is $31,065.
Wow.
family of four.
Wow.
When you think that the median income for someone in the country is 59,000,
Mm-hmm.
even if it's a uh, two worker home making a little bit over 100,000, then that's still almost 30% of their income paid
Yeah,
just in
right.
healthcare.
Yeah. So you talk about functionally uninsured, so that basically is they can't meet their deductible. But what about people? There's other insurance that they that I've heard about where it's kind of like a partnership or something aligned with a religion or church or something. I don't know, where you kind of everybody helps to pay the bills is what it sounds like. What is that all about?
Yeah, absolutely. That's called medical cost sharing. And there are certainly some organizations that are faith-based. There are some that are Christian-based, some that are very specific. Like there's one just for Catholics. But we also at Eagle Care we offer access to a medical cost sharing plan, but it's not faith-based. It's not religious. All you really have to believe in is that we're here to help our fellow man.
Mm-hmm.
And whenever you go down that pathway, of course, it's a lot more affordable. Your out-of-pocket expenses are a whole lot less. We at Eagle Care match that up with some other benefits to make it feel more like a traditional plan as far as prescription drug coverage and access to doctors, because most of your medical cost sharing plans don't offer that. They are more or less a catastrophic type option.
Mm-hmm.
We offer that because we really believe that people they're afraid to go to the doctor in many cases because they don't know what the cost is going to be.
Yeah.
And so by providing that transparency and in many cases providing access to a doctor for zero cost, unlimited access to that doctor for zero cost, that removes that barrier. And then it's a lot more likely that person is going to stay healthy, right? I mean, if you
doing
have
the preventative.
doing preventative, and so many people now have chronic illnesses, and that chronic can be from diabetes to thyroid issues to whatever it is. Fill in the blank with whatever those are, and not taking care of that. I mean, chronic issues can even be, say, high blood pressure, high cholesterol. There's about 100 million people with hypertension in the country, and almost half of those it's uncontrolled, and a number of those don't even know that they have it because they just will not see a doctor on a regular basis.
Very true.
It's removing those barriers, because that's where the funny thing is I know we use a catchy little name because why does healthcare suck? But the real issue here is not that the healthcare in this country sucks. Typically, if you get to see a doctor, it's going to be a very quality doctor, and a lot of times you're going to have a really good experience. What we really have is an access issue. So people have a hard time getting access to healthcare in a realistic and good way, and in an affordable way. That's the biggest problem. It's really, why does access to healthcare suck?
Right.
And think about this. I don't know if you've ever had this happen to you, but imagine that you go and see your doctor. Y'all get a determination on what's going on. You decide you're going to have a certain treatment plan. That's going to require the doctor to get his authorization from your insurance company. They send it over, and the insurance company says, "Nah, you don't need that."
Yeah.
Wait, what?
That's happened.
Yeah, but what makes the insurance company decide that they know better than you and the treatment plan that your doctor have done?
Right.
We've seen instances where treatments for cancer that were determined by the oncologist. So the oncologist says, "This is what you have. This is we've got all the tests here. This is the recommended treatment." It goes to the insurance company. The insurance company denies it. They don't like this. They don't want this treatment. Well, after review, the doctor at the insurance company that determined that this was not that basically said, "No, oncologist, you don't know what you're talking about," was a pediatrician with no background in oncology whatsoever.
Oh.
But this is unfortunately not an uncommon practice. And now, and you may have seen some of these lawsuits coming out. Now we're seeing some of these auto adjudicated by AI, and they're never seeing a set of human eyes.
Awesome. So the other thing you talked a couple times, you mentioned about visiting whatever doctor. I know that one of the things when I was in corporate, my doctor was tied to a hospital. And so what we've seen in the last several years is hospitals and insurance companies are at arms with one another. And
Yep.
so whenever I went to a different doctor, because my doctor was, in this situation, that doctor, because I was out of network, even though I was 5 miles away from my other doctor, I was out of network. It cost me $320 for the doctor to spend 5 minutes with me.
And did you go see that doctor again?
No, I did not.
All right. So there is another barrier to healthcare, right? But here's what happens even when you stay in network many times. I mean, you mentioned your doctor was part of a hospital system. Well, the sad truth is about 70% of our physicians in this country now work in corporate. So they're either working for an insurance company, they're working for a hospital system, or they're working through a private equity company. And I don't know if you've seen this, but we're having a huge push. I'm actually doing an audio room on this. We're having a huge push right now by CVS, Walmart, and Walgreens into the primary care world.
Yeah, I've seen that. Yeah.
And so once again, these are just more organizations that are being bought up by big corporate entities that are trying. And let's be honest, what are they doing? They're trying to make a buck, right? I mean, it's not. It's once again, it's profits over patients is what's really happening here. And I think it's very interesting that right now we're seeing a number of pharmacists that are walking away from their jobs, that are protesting at CVS and at Walgreens because of overwork and all of the different things that they have to do and dealing with insurance companies and just the whole thing, this whole gamut. Well, the interesting thing to me is whenever I talk to primary care doctors, they have almost identical complaints. And now think about that. This is the complaints they have working in these hospital systems and working for private equity. And now these same entities that are doing this to pharmacists are buying up primary care. Do you think there's going to be any different?
No.
I mean, come on, it's the same exact thing. So it's really not, while on paper, maybe it sounds good, while reading the story of, oh, wow, I can go to my doctor at the local corner drugstore now. That may, in theory, seem like a good idea. The bottom line is it's still not going to give you any more than that 5 minutes with that doctor.
Yeah.
And that's the problem, because right now we have such a shortage of primary care doctors that it's taken anywhere from 2 weeks to 4 months to get into the doctor.
Yeah.
What do? You sit in the waiting room for an hour and a half. Then you finally get in the room, and you're in the room for 15 to 20 minutes. And then when the doctor comes in, he does a flyby, just like what you were talking about.
Yeah.
Comes in and doesn't listen to you. That's the other biggest complaint that we hear is the doctor didn't even listen to me. It's almost like they've come in and they've talked to you, you've talked to the nurse, you've talked to the intake person, and when they walk in the door, they've already made a determination of what's wrong and what they're going to do.
Yeah. I had one doctor who I really loved because she talked to you and found out and kind of worked with you. You felt more like a partnership. And she was let go, detached from the hospital so she couldn't work for that hospital anymore. So therefore she couldn't work for the doctor's office anymore. And it was very interesting. Yeah.
It's unfortunate, but primary care doctors are some of the lowest paid in the whole medical world. That's another reason why they have such a hard time getting them coming out of medical school now for doctors to go that route. And we're losing primary care doctors. They're stepping away. They're leaving the practice. So they're going into practice by themselves, which I'll talk about in a minute, which is direct primary care. And that's a beautiful thing. That's what's going to save us all, as it were. But going back to what we're seeing there, when they're in this hospital system, these primary care doctors have quotas to meet on referrals. They have quotas to meet, and they also get bonused on referring. You're in a funnel. So here's your funnel, and it starts here at the bottom with primary care, and every layer it goes up. Every layer, the hospital system makes more money. In a perfect world for them, you get to see 2 to 3 different specialists as you move up that funnel to eventually the surgeon get you your surgery, and then they're able to make the maximum amount of money by going through that process. Then they also, of course, refer you to your physical therapy or whatever aftercare that you need right there in the same health system. It's a money-making thing. One of the others, and this is something that's came up recently, and it's a sad thing. Dr. Eric Bricker, who is a big proponent of what's going on out there and talks a lot about it. He does a daily broadcast on LinkedIn. Said that there's lots of evidence out there to show that some of these treatment plans that are going up this funnel we're talking about, they're chose strictly because of their cost. And I'm not talking about their lower cost. I'm talking about their cost. They're chose because it's going to cost more. Remember, if the insurance company is paying, then the hospital doesn't care how much it costs. I mean, if you got a $5,000 deductible, maybe they'll get it from you, maybe they won't. It doesn't matter at that point in time if they're getting a $500,000 out of the insurance company, right?
Yeah, right.
So it's a very interesting dynamic. You wouldn't think that a treatment would be devised based on cost and on profitability. It should be effectiveness is what it should be. But the evidence is there to show that that's simply not the case. Another frightening thing is the lack of second opinions now. Most insurance companies no longer require second opinions, even on serious conditions. Now, what that has done is caused many people to be treated for conditions that they don't have, or to not receive the proper treatment for conditions that they do have. A study done by the Mayo Clinic that began in 2017 showed that thousands of patients that they had come into them for second opinions, that only 12% had the exact treatment, right diagnosis and treatment prescribed for them. 88% had something that needed to be changed, and 21% were completely wrong. They were completely off the chart. Nope, this is not what you have. You don't even have this condition. And so obviously the treatment plan was not correct. So I thought that was
so
amazing.
Scary. Yeah.
It really is. And then Cleveland Clinic started one this year. It started in March, and they've had hundreds of folks come in for second opinions, and half of them, 50%, have shown that the initial diagnosis was not correct. One of them was so egregious that the gentleman was diagnosed with cancer and was given a treatment plan that, of course, included chemotherapy and radiation for his cancer. Turns out he didn't have cancer at all. He had an arterial aneurysm.
Oh my gosh.
Not even close.
Yeah.
So, the chances are is this individual would not have made it. First of all, we're fixing to poison him for something he doesn't have, and we're never treating what he does, which is a very serious situation.
Wow. So you call out in my notes alternative funded healthcare. Is that the primary healthcare you were talking about?
Yeah, so alternative funded, our traditional way of accessing healthcare is through insurance, right? And a lot of folks in this country believe that they're the same thing, that you must have health insurance to get health care. Well, all a health insurance plan is components put together, what we call the healthcare supply chain, put together to give you that access. Now, most of that, of course, is owned and operated by the insurance company. Therefore, they make profits all the way around in that circle of supply chain, including on the third-party administrator, which processes your claims, including the PBM, the prescription drug management, including medical management, so the approval or disapproval for different services that you may have. The network, they're the ones that the insurance company, if you're using their network, then they're the ones who negotiate the rates. So all different pieces of that, they make profits on every bit of that. Well, the bottom line is we could build that ourselves. We don't need Blue Cross or United or Aetna or one of them to do it. As a business, you can do that. But how are you going to do it? You don't know how to do that.
Yeah.
There's about 500, a little bit less really, folks like myself out here across the country that are doing this. We're really building, rolling up our sleeves, finding the partners that are truly transparent, and providing the services in a compliant way, by the way. So if you're a business out there and you're worried about moving to something that is not compliant and will cause you a bunch of fines, this is not the case. We build you a health plan based on the needs of you and your employees. It's truly customized because not everyone needs one of those off-the-shelf plans, but that's all you're offered by one of the big companies. So we take things like direct primary care, which is membership based, by the way, Vicki, and there's no incentives whatsoever for that doctor that you're seeing to send you anywhere else. In fact, what they really want to do is take care of everything, including most of your chronic conditions. They're trained to do that. They have the ability to do that. And many of them have partners that are doing specialty care as well. So if they need some information, let's say from an endocrinologist, they have someone they work with that is a specialist in endocrinology that can give them some advice if they were working with something you had going on or something I had going on and they had some questions. If it gets to the point where you do need to see a specialist, then they're going to refer you to, you're going to work together, first of all, kind of like what you were talking about with your doctor that you liked. Y'all kind of made some decisions yourself. Y'all are going to make those decisions yourself. That person's going to help you through care navigation and finding a doctor that you really like. And when you build plans this way that are based on primary care, based on care navigation, then typically all the services that are received in that plan that the employer offers to the employees, all those benefits are zero. It doesn't cost the employee anything. They get to truly have access to health care. And even if it ends up going to surgery, most of the time it's going to be a zero cost for those services. This is what care navigation can give you. Now, usually what happens with a company, of course, this is where the alternative funded comes in, is the insurance company, that's all you're doing is you're throwing money at the insurance company. Those premiums go up every single year. So you just throw more money at the insurance company, and those premiums just keep going up. You're feeding the beast. All you're doing is over and over and over. Well, that's the way that we have funded healthcare, is we fund an insurance company and then we just let it go. Well, instead, we're going to take the company without having any more risk than they currently have now with an insurance company. We're going to take and build this plan in the design that you want to. Typically, we're going to save you 20% over what you were already paying the first year. And really, the sky's the limit in how much you can save, depending on the type of participation that you have in your plan. I mean, we're going to be very engaging with your folks and make sure that they understand what's going on and the benefits that it's going to be to them. You know, people wonder, why haven't I got a raise in 5 or 6 years? Or why, when I do get a raise, I don't really get a raise, because when I do, it's offset by how much our premiums are going up on my insurance.
Right. Yeah.
Right. Well, it's because our mentality is, I have this card right here that says Aetna on it. And as long as I use this card, I don't have to worry about paying anything, or I have to pay my copay or whatever. Well, you're killing yourself. You don't realize, but you're putting so much of these things on this plan. And many times the insurance company is approving things that cost a lot of money, but it's just coming out of the employer's pocket. And when it's coming out of the employer's pocket, there goes your raise. Yeah. So the employer is now a fiduciary. They're supposed to actually, employers are fiduciary of their health plan. Whether they like it or not, they are. Right, and we've had some lawsuits against insurance companies by employers saying that they should have been fiduciary, and that they lose every single time. The law says the employer is the fiduciary of the plan, but they keep choosing these large insurance companies to represent them. And it's always going to be the same thing. They are not your friend, and they are not there to help you. They're there to make money for them. That's what they're there for.
Oh my goodness. Well, time has flown by, and so we probably have another hour that we could chat on this, and definitely want to have you back, maybe sooner than later, to continue this discussion. But if you are at all intrigued by what Harlon has to say today, please take note of what I'm going to be sharing now, the screen with his contact information. If you're just listening in, I will read this to you, but it is going to be available on my website, the findyourleadershipconfidence.com, as well as my YouTube channel. So, excuse me, his website is eaglecarehealth.com. Again, that's eaglecarehealth.com. He can be found on Facebook at a couple places, H. Pickett Insurance Broker or Eagle Care Health. LinkedIn, he's at Harlon-Pickett. Instagram, you can get him at HP Insurance Broker or Eagle Care Health. And on Twitter, he's HPI Broker. I'm going to let Harlon talk to you about what you can find when you go to eaglecarehealth.com. Go ahead.
All right. Thank you very much, Vicki. All right. So we have talked a lot about the different ways that we can help employers. We also can work with individuals. We also work with doctors' offices. If you're a direct primary care doctor out there and you are ready to be part of some of these plans and work with employers, we can help you there too. You can find out information about all of these things on our eaglecare.com site. We also offer access to a number of other programs, so you can go and check that out too. And if you don't mind, Vicki, I'd also like to plug my podcast that has a release every single week, and that is the Health and Wealth Power Hour. You can check that out at hwpowerhour.com. That's hwpowerhour.com. We talk about all kinds of things. Sometimes we're in the industry, sometimes we're not. We are jumping around. Yeah, just like you, Vicki, I like to find interesting people. People say, how do you decide who's going to be on it? I said, I like them. Or I want someone to talk about it. You know, that's one of the cool things, right? You get to choose who's on your show.
That is so true. So again, that's hwpowerhour.com for that podcast, and to get those weekly doses of good information about insurance and healthcare and how we can maybe make this a little bit better for your company, and your doctor. So once again, thank you so much. This has been really interesting. I probably have 15 more questions that I could ask you. Definitely want to have you back so we can chat some more. As always, I remind everyone that life is a journey and it's up to you to enjoy the ride. This is Vicki Nettling signing off.
Thank you for tuning into the Find Your Leadership Confidence podcast with Vicki Nettling, where we share impactful lessons that help you grow as an individual, grow your confidence, and find the positive and good within you so you powerfully and authentically become the best version of yourself. Remember to visit our website at www.findyourleadershipconfidence.com and enjoy even more great episodes like this one. Again, while you're here, subscribe to us via your favorite network. We look forward to seeing you next time on the Find Your Leadership Confidence podcast.